afternoon, trying to set this up so that we can actually send these to the MCI YouTube so that you will be able to go and look on them. What I am going to ask everybody is to, if you will just, show your faces so we see you're there. Um, and we're, again, apologize for the technical difficulties, uh, something beyond our control. This is being recorded. And I do understand that some of you that have contracts with the Early Learning Coalition will need to leave at 1 for that meeting. So we do understand that. And it is because of that that we're gonna start moving right away, because we do have 2 guest speakers that we've invited. Um, and Ms. Louise, I'll turn it over to you, and then I'll introduce Mr. Karch. Well, while Louise is doing that, there's Patrick Karch. Patrick Karch is one of 2 senior, and I want to make sure you all understand that senior supervisor, even though he's young, senior supervisors in child care regulation. Um, Ian Fleury, as most of you may know, is trained everybody, including myself and Patrick. And Patrick knows everything that he knows, and probably some other stuff. Uh, it was a pleasure to get these 2 to come on, because as we spoke last time, and as I've shared with you, things keep changing. And Patrick is nice enough to give us some of the updates of what's going on. So I want everybody to listen carefully and understand that a week from now, that may change again. And that's why it's important that you stay in touch with your counselor, your licensing inspector. You reach out to Patrick if he is one of the your supervisors. Reach out to DCF to make sure that you will stay in compliance with all of what's going on, and not find yourselves being closed down by the county or by the police department, and understanding the difference of things as it relates to DCF.
Thank you, Jeff. I appreciate the kind words. If anybody can't hear me for any reason, I mean, just let me know and I'll speak a little louder. But there are a few updates, and I did want to always remind you guys that anytime that DCF has any news or announcements or anything like that that we want to share with you guys, we do put it on our website, which is myflfamilies.com/childcare. And when you get to that portion of the website, it has recently changed a little as far as how they formatted the website. However, the information is still in the same categories. And anytime that we have new information that we release, whether it be whether it be regarding training or background screening or upcoming webinars, or even in regards to what we're going to discuss today, in regards to coronavirus or COVID-19 related issues. They put on the website some like the CDC guidelines, which we'll briefly get into, as well as like the Department of Health's role when reporting a positive COVID case. So for those that don't know, if you ever are in doubt or ever want to see if there's anything new, that is a portion of the website. Again, it's called, the portion of the website is labeled News and Announcements. And also under that section, there's what they call a news archive. And in that archive, you can find all of the news and announcements that have ever been released by DCF, so it's a helpful resource in the event that you may not be able to reach your counselor or whatever the case may be, or in this case of the pandemic, stay-at-home order. So it is a good resource to know for those that may not be aware of it. So as far as the CDC guidelines are concerned, And I do want to share some stats with you guys. And this is I'm pulling this directly from the Florida Department of Health's website. So in Florida alone, we've had roughly 584,000 cases in Florida of COVID alone, which is a very high number. And out of those 584,000, there have been just under 10,000 deaths, which is a very staggering number, and it's alarming. And so what you guys want to do is take the CDC's recommendations as far as how to prevent the spread or, as far as the exposure of this contagion. If you have a positive case, you want to try to, again, adhere to what the CDC is recommending. Now, the CDC recommendations can be found on our website. There is a website linked under the news and announcements. It is labeled the CDC Guidance for Schools and Childcare. And the idea is you still want to comply with DCF's rules and requirements because they're always going to be there. And the idea is us being the minimum requirements. The idea is to incorporate what the CDC is recommending to strengthen your preventative care. Because at this, in this day and age, with the pandemic, we need to approach the situation as in a preventative manner. Ideally, you want to prevent the exposure, the spread of this type of illness. So the idea is you want to, make sure hand washing is taking place. It's recommended that you have a sanitizing procedure in place so that your staff can follow. And not only your staff can follow, but your parents can, of the kids in care, can have that peace of mind that when the kids go outside and play, for example, when, before the next group goes out and play, the school is going to sanitize and disinfect the playground equipment. So that's just an idea of, what I'm referring to as far as that goes. So ideally, we want our agencies to work together because we want to be a unified front. And at the end of the day, I'm a firm believer that, I am my brother's keeper. So what I mean by that is the more we watch each other's back, the more we help each other, share information, the better. And so for us, we've been working hand in hand with the Department of Health, and those, people have been amazing. They've been helpful. They can provide anybody and everybody with helpful resources and information. And it allows, through a joint effort, that allows us to address your concerns as the provider in a timely manner. So just as a reminder or a simple refresher, in the event that you do have a positive case of COVID, what you do want to do is you want to report it. And of course, when you do report it to the Department of Health and DCF, you still want to protect the HIPAA rights of your staff and children. So when DCF is calling, if that case or if this issue does arise, which, knock on wood, hopefully it doesn't. But if it were to arise, you want to protect the names and the information concerning the individuals that are affected. And what DCF would need to know is what I believe some people refer to as the exposure tree. And what that is we need to determine where the exposure took place and who was exposed and how long they were exposed. Because then when the Department of Health has to go down and narrow down who may indeed have been truly exposed to the virus. So that's where the cities, the mayors of Miami-Dade County, that's where his emergency order comes in. So as you all know, masks are required. And I know it's a political item and I'm not gonna get into the politics involved because that's above my pay grade and that's neither here nor there. However, what it is saying is that individuals that are 2 and older must wear masks, as well as limiting the amount of individuals in each respective group that is when I say group, I'm referring to the room, because the city, again, they have different requirements. So you do want to create a situation where you're complying with our rules and with what the city has put in their order, what the mayor has put. So in this case, two main elements is that individuals that are 2 and up must wear masks at all times. At least it's recommended. And it's also recommended that in each room that there only be 10 students to 1 staff. Now, don't confuse that with our ratio requirements, because our ratio requirements are still in play and they still must be adhered to. But what the order from the city is stating is that for those 10, let's say they're school age kids, which we all know has a ratio for DCF of 1 to 25. So what that means is that you can have 10 kids in that age group with 1 staff and you're complying with the city's requirements. If you exceed that and you have 1 staff with, let's say, 12 kids or 11 kids, that may be an issue with the city. And what the city does with that is between you and the city, and it's not something that DCF can necessarily enforce, because that's not our rules. However, the city is requiring it, and they are looking into those issues. And we have been aware of providers who have been viewed to be non-compliant by the city for their recommendations. So I encourage all of you, and I only say that to say, take it serious, because although we're not enforcing that rule or that order, the city is, and they're still encouraging, and they still, to my knowledge, haven't lifted that executive order. Now the CDC does offer some helpful tools for schools and childcare programs that can help you out. They have on their website, which again, the link to their website can be found on our childcare website. If at any point you wish you would like myself to send you the link, I can do that. Just we'll coordinate with Jeff, and worst case, we can email you the link if you would like it. So how, like I said, they're definitely a resource that you should take advantage of. And as I mentioned, in the event that you do have a positive case, you do want to contact your licensing counselor. If you're unable to get in contact with your counselor, send an email. You have that documentation. And also you can call any one of the supervisors, or which is myself, Ian Fleary, Carmesita Smiley, or Naomi Morenci, or even Suzette Frazier. Because the idea is we want to make sure, we don't care who you report it to as far as the counselors go. We just want to make sure that we are aware of it so we can help you. And then on the flip side, you do also want to contact the Department of Health. Now, there are 2 individuals who have been an asset to the DCF that work at the Department of Health. And their 2 names are Debbie Summers and Tina Fernandez. Both have been amazing and have helped us out. And they are the individuals that are spearheading the coordinating with providers who do have positive cases. So, I encourage you all to, I'm not saying you're not taking it serious, but take it serious. Protect yourselves, protect the staff, protect the kids, and be transparent. The idea is to not, don't be deceitful about it. Don't try to hide it, or not saying that any of you guys are, but for the sake of the greater good, we're coming to offer help, to be of assistance. So I know DCF can look like the big bad guy sometimes, and it is what it is. But right now we want to make sure that you have all the help and information that you need to not only prevent the spread, but to also address any positive cases that you may have. So,
Patrick, if I could just say one thing to add on to that, and
yeah, go ahead.
I won't say who, but we do have at least one provider on right now who experienced that and followed the rules. She called DCF, she called the Department of Health, she did what she had to do, and she's in operation. And I just want to encourage and back up 100% of what you're saying. Be transparent. Everybody is here to help. We want you to be successful. DCF wants you to be successful. I know MCI wants you to be successful. The Early Learning Coalition, the Children's Trust, everybody. But when you work as a team, as you said, Patrick, it makes it easier. And we have had some providers go through it, but because they followed the rules and kept those 10 kids, they were able to isolate, close down temporarily, turn around and open back and be in awesome shape. So I just want to, add that to that, we support you 100% on that. Thank you, Patrick.
Yes, and to the provider, whomever that may be, thank you for, following the correct procedures. What I will do is I will try to, while I'm discussing this, I will put in the group chat of this training, the link to the CDC's website. So I apologize if it's lengthy. I'm just copying and pasting. But for those that want to take a look at it, as I'm discussing it, I just added it to the chat. So you can, if you just click on the little chat box, you can see the link and it'll take you directly to the, again, the CDC's website. Now, as I mentioned in this website, there's many helpful resources, and opportunities for growth. The one thing I do really love about this website is they have flyers, they have posters, they have information that is geared towards not only parents, but to the children. And ideally, any and all rules for DCF, as far as the requirements go, that are dictated towards hygiene, sanitation, cleaning. You want to not only meet those minimum requirements, because that's what DCF's rules are, they're the minimum requirements, but you want to take those minimum requirements and you want to go beyond that, and which is ideally the best practice. So in this website, or the website that I provided, there is a category under the guidance for schools and childcare. There's one that is called cleaning, disinfection, and hand hygiene in schools. I would recommend, as you all know, kids can be, I used to work with kindergarteners. I used to, substitute teach kindergarteners. So I know firsthand how messy kids can be and how washing hands consistently can be a challenge. So the three main bullet points that the CDC recommends for that, and for cleaning and disinfecting and hand washing, is these three simple bullet points. And the first one is develop a plan, put it in writing, develop that plan, make it thorough, make it cover all corners, all aspects of what you provide. Once that plan is developed, make sure your staff is aware of it, but more importantly, implement the plan. Follow through with it, be consistent, because the third one is maintaining and revising the plan as needed. So again, consistency is key. So once you have that plan in place for your cleaning procedures, your hand sanitizing, how to enhance it, all these certain little elements that we require, you want to maintain it. And then, of course, as with any plan, sometimes there's areas where it needs to be adjusted or modified. So, don't be overly rigid in your plan. Allow the opportunity for flexibility, for growth, for development. And by doing so, it will allow you to monitor those procedures a little better, and it will create a better situation for not only for your staff, which is also important, their livelihood and health that matters, but also of the kids. And because at the end of the day, we don't want kids to not have a place to go, and we don't want to have a situation where you guys are unable to run your business and provide services to the community, which we are all grateful for. Now, another item I did want to briefly discuss. Well, before I go further, does anybody have any questions about the CDC recommendations? Or the
Yes, I do. Oh shoot! Hold on. I'm sorry.
Okay.
My computer doesn't have a camera. Doesn't have the. I can't hear you. I can't speak, and so I have to use both the phone and the computer. Apologize. Hi guys, everybody.
Hey, Yvonne.
Hey. I'm glad everybody's doing well. And I thank you guys for this because it's really helpful and it makes a lot of things that are, you know, so many new things are coming out that we're just, you know, want to be clear. As far as what you were saying about the two years and up with the masks, is that a recommendation or is that a requirement?
Well, that was in the mayor's order. So that's his executive order that kids 2 years and up need to be wearing a mask. Now, okay. DCF, it's not a requirement for DCF. So as a DCF representative, I cannot say it's a requirement for us. However, based off what the mayor is saying, it is a requirement for them. So you do want to, and I know 2-year-olds and 3-year-olds, you know, it's difficult getting them to wear masks at all times. So you just want to, you know, try your best to adhere to that. And but to answer your question, that is that as far as the last executive order, that was a requirement for that order.
Okay, so because to be truthfully honest with you, I have children here that the parents will not, you know, send them over with the masks. So is that something that the center has to now be responsible for, providing the mask for the children? Yes, ma'am.
Once they become in your care, the city, that's their expectations of you as the business owner. So if you have a situation where a parent is being, you know, making it again, I know it's a political hot topic and
are not comfortable with that. I mean,
and that may be the case, but you know, the executive order was given to, it is public information. I would encourage you to, you know, review the emergency order. And if you have parents who are not wanting to do that and they're not wanting to comply, I would encourage you to discuss, you know, with them what you're required to do as the business owner based off what the city is expecting from you. Because what you don't want to be in is you don't want to be in a situation where parents are putting you out of compliance with any rules or any requirements. Because just like we wouldn't put you in that situation as the department, you don't want to allow parents to put you in a situation where you're subject to some form of disciplinary action. Now, I'm not saying that is the case that the city will do. I'm not saying that at all, but it is a possibility. And so again, the best practice is to try to bridge the gap between what is required from on your end to what the parents, you know, to what the parents need to do to help with that. And in this case,
that's for the entire day, even nap and playground?
Well, I mean, outside time, yes, it was encouraged. I can review I have to review the emergency order again regarding nap time.
Yeah, if I can chime in on that. During nap time, it's not required. I mean, it's not the recommendation. Now, remember what Patrick is telling you. This executive order that came out of Mayor Carlos Jimenez's office is his executive order as it passed, as it relates to childcare, which under the rules can be more restrictive than DCF. It can't be less. These are not DCF issues. DCF's not going to come in and write you up for it. However, it has happened to providers where they are now in trouble with law enforcement and may be forced to close their business altogether until they comply, or with the Department of Health. Now, what I know that there's some providers that they've got their own face masks for the kids. They disinfect them. They've got their name on them. They're on a bag. Again, this is a recommendation from the CDC. This is not DCF. The kids put it on, and then they leave it there, and then the provider's not relying on the parent to bring a mask, because what if they forget?
Right.
But I want you to understand, though, I know that there's some politics involved in it, but just think of it like this. Your responsibility as a provider is to the children and families you serve, but also to your staff and to yourself and your business. So that if somebody puts you in a situation where you're more susceptible to having an outbreak, where then now you may have to close for a month or two, depending on how spread it is, that then hurts your business more, because now you've been forced to close down by the Department of Health. So, and I know that right now, this is a difficult time for everybody because number one, you can't have the same amount of students, all of these recommendations, and you're providing a service and you still are trying to survive because you've got people to pay, you've got yourself, you've got, everybody understands that. And that's why we're doing this, is because this keeps evolving and changing. And DCF, again, is not, that's what Patrick Karch was saying, is not gonna write you up for that. But your biggest problem may be the fact that if it spreads and it's not contained, and there's some people on here who've had it, contained it, and back in operation, if it's not contained, then you may be shut down for a month or more, Yvonne. So you've got to weigh that, like Patrick was saying. But I just wanted to throw that in.
Yeah, I just wanted to make sure and know, is it a recommendation or is it mandatory? That's the only, because, you know, there's a lot of recommendations, but is this one of
what I've always advised to everybody is go into Miami-Dade County's latest executive order from Carlos Jimenez, print it out, have it there for you, make sure your staff understand it, and also share it with your parents, because a lot of people just don't know, because there's so much information and it keeps changing. What's true on Monday is now no longer true by the time we get to Friday. So as a provider, you've got to utilize, and I know it's extra work, all these resources to stay on top of things. But that's those providers that I see doing that, and I know it's extra on top of everything else, have the ability to hopefully get through this and able to, for lack of a better way of saying it, adjust our sails to the wind that's blowing. Because if you don't adjust your sails, your whole business and everything is going to tip over and you're going to drown. So that's my little analogy for that. But if there's any providers on here who've experienced it that want to share how they've handled it and how it makes it better, feel free to do so. I won't call you out, but I just want you to know, Yvonne, you've got to take the reins. I know parents will say, I'll go somewhere else, but your ultimate safety are those children in your care, you, your staff, and your family that you go home to. So and your business. That I'm going to be quiet now, Patrick.
No, you're good, Jeff. But to answer your question, ma'am, it is an executive order from the mayor. So I would recommend that adhering to it to the best of your ability in order to prevent, possible fallout or possible actions from the city.
Got it. Thank you.
No, you're welcome. And that was a good question. So thank you for asking that. And, as far as the CDC guidance, I'm gonna just touch up on a few small items. If you guys have any questions about these recommendations, just feel free to chime in. If you feel uncomfortable, talking on the mic, you can always type your questions in the group chat and I can answer them that way as well. As far as, the social distancing strategies, I just want to give a little reminder on that. So if possible, childcare classes should include the same group each day, if possible, and the same childcare teachers should remain with that same group each day. Again, because it's limiting the amount of exposure to other individuals. So ideally, you want to keep each group of children in a separate classroom, limit the mixing of children. So by doing, what I mean by that is staggering, for example, staggering your playground times. If group A goes out at the playground at 11 a.m., make sure that group B goes out there once those kids come inside, and then so on and so forth with your other groups. And then in between those usage or the outtime, the playtime for each group, you want to have your staff or a staff member disinfect and sanitize the equipment outside prior to the next group going out there. Now, it could be labor intensive depending on how big your playground is or how big the equipment is. However, doing so again will lower the risks of a positive case taking place and exposure from occurring. Now, doing so, like Jeff mentioned, although tedious and could be time consuming, I'm not going to lie to you. But by doing so, will help prevent cases from occurring and will help prevent the possibility of you guys having to close your business for, the quarantine for a certain period of time based off what the Department of Health says at that point. So a lot of it could be frustrating. Parents may be combative, but the idea is it's for the greater good, and it's also to help you guys stay in business and keep your doors open and keep your staff and kids safe. Also, if possible, at nap time, ensure that the children's nap time mats, sorry, that's a little tongue twister, the nap time mats or their cribs are spaced out as much as possible. Now, for us, the minimum requirements, as we all know, for the distance between cribs and mats must be 18 inches at a minimum for DCF. Now, however, just like with social distancing, it's recommended that you enhance that. And rather than it just being at a minimum 18 inches apart, you try to distance them to 6 feet. Now, if you're not, let's say we go out there and we do an inspection tomorrow at, let me see which providers is in here. The first one I see, Mary Poppins. I'm not picking on you. I just see your name there, so I'm going to use your name. So let's say if we went to Mary Poppins tomorrow to do an inspection and we see that, yes, they are adhering to our 18-inch minimum requirement, no violation. Perfect. Now, if we also notice that they're not doing the 6 feet distance between nap time, it's not going to be a violation, although we would recommend, hey, per the CDC, it's recommended that you try to do 6 feet. You won't get a violation, but it will come in. We'll do our part to try to encourage and offer TA and so on and so forth. So that's just one example of how you can take the social distancing measures and apply them in other areas of your schedule, like in this case, nap time. But again, for us, as long as you're adhering to 18 inches distance during nap time, won't be a violation, but we do encourage that you enhance that distance. Another thing to consider is you want to set up multiple activities so children can rotate and not all be in one area of the classroom at the same time. So if you have one corner in your classroom is the reading time, one corner is arts and crafts, and then the other corner is movie time or whatever the case may be, that allows the kids to still be in the classroom. And again, you still want to adhere to ratios and again, the 10 kids to 1 staff from the city's order. But by doing that, it kind of keeps the kids in the same room, but also allows them to be a little separated. And that way, in the event that a kid takes off their mask, they may be close to like 1 or 2 kids, but they won't be close to all the others. And it gives, again, it gives you guys a little more space between the kids while they're in the same classroom. Now, another idea is for older children and staff, you definitely want to, you can definitely utilize the other types of face masks, like face shields. Obviously for children under the age of 2, the idea is to not use masks on them because it becomes a hazard. It becomes a suffocation hazard. So that's why the age group of 2 and under 2 is not being recommended to wear face masks. Again, it becomes a hazard. And to answer your question, if it's nap time, it becomes a hazard as well during nap time, which is why it's not recommended. Like what Jeff was saying, it's encouraged but not recommended. Does anybody have any questions about those social distancing strategies or ideas of it? Okay, I'm gonna copy and paste that into the group chat just in case.
Patrick, I know that Reverend Dinkins, had a question about DCF helping with testing, and I'm not aware that DCF is doing any of that. Are you?
No, DCF, as far as our unit, child care licensing, we are not doing testing. And if anybody is doing testing, it should be the testing should be done by a medical professional.
Correct.
So your teachers who are not medical, not saying that it's taking place, but the teachers that aren't medical professionals should not be doing COVID tests. Now, testing temperatures and stuff like that, that's fine. That's something different. And your teachers can do that. However, the actual testing for positive cases of COVID should only be done by a medical professional, like a doctor or a nurse practitioner or any of the multiple testing centers in the area. Is that something that the health department would consider? Honestly, I'm not sure. I can, what I'll do is I'll provide you with the contact number to Debbie Summers, who does work for the Department of Health. And anytime that you guys may have God forbid, if there is a positive case, you can always report it to Debbie Summers. I'm gonna put her contact number in the group chat. And as far as that question, Mr. Reverend Dinkins, I would ask Debbie and see what she says, because you know, them being a whole other agency, I don't know. I don't want to say the wrong thing as well. So that number I just put in the group chat, 786-412-8705. That is Debbie Summers. She does work at the Department of Health. She's amazing. She knows what she's doing. And she has a large amount of knowledge on how to prevent the spread of any virus or illness. I would recommend, if you have time, reach out to Ms. Summers. And like I said, if you ever have a positive case, you know, knock on wood, I hope you don't, but Ms. Summers is somebody, is one of the individuals that you will need to report the positive case to.
Excuse me 1 second before we move on. How many of you have to go to, because I know ELC, the Early Learning Coalition, has something at 1, and some of you may have to go, and I just wanted to make sure that we got a chance to talk to Dr. Fleury, Ian Fleury, who I mentioned before, about reading about the background, and then whoever can stay, we can continue from there. I just want to make sure, if that's okay, Patrick, we could just
That's fine.
have Ian Fleury, who is a new grandfather, by the way. Ian, if you're there, if you will speak to, there he is. If you will speak to the background screening piece that seems to be coming up a lot, and anything else up to 1, and then anybody who can stay with us, we will be more than happy to answer your questions. If you'll just unmute yourself, Dr. Fleury.
All right, I think there I go. All right, I hope everyone can hear me. Good afternoon, everybody. Mr. Hurst, thank you for this opportunity to speak with providers and agencies about background screening. Mr. Patrick, thank you so much for a wonderful job. Today, my piece is going to be discussing the background screening. As most of you know, it's been about 5 years since the clearinghouse was launched and is now the official mode of screening. It is a system that is designed around your needs and operation, that you have the control of processing, getting the results, and requesting screening information. Also doing some reviews of your own background screening. You are now the controller of accessing your account, getting information, being notified, and of course, making that decision on who you want to hire or who should be part of your team. That requires background screening. So with that being said, a lot of you are now coming up under the 5-year rescreening. A lot of people who have done their screenings. You're just about that time to refresh, to redo. For most of you, it'll be an agency review. For a few of you, it will be a full screening, but nonetheless, there are some critical elements that must be followed. Person needs to be actively employed with you. And once you screen an individual, that individual results will be accessible to you. You must create an employee roster in order to get the results back, in order to process a screening for any individual that is in your employment. So make sure that anybody whom you hire and you run a screening for that individual using your OCA number is also added to your profile in the clearinghouse. So if you don't do that, FDLE or the Agency for Healthcare Administration could technically revoke your access to the clearinghouse, and DCF could in turn cite you as well. So with that being said, you go into the clearinghouse and you initiate a screening for anybody. You have to initiate a screening. And what that does, it creates an appointment for that person to go out and select a live scan vendor. You can select a live scan vendor and you send that individual with the printout of that initiated screening. What happens there is that it protects you and the individual from possible fraud, because the person is not filling out or giving their demographics to the vendor. The appointment is in the system. They just present that paper at the time of appointment. And once the screening is done, they walk away with that document. So they're not really leaving anything behind. They're not leaving, any confidential information that they don't feel comfortable handing over to a vendor, and they keep a paper. You may just need to sign in or fill out a simple form for their purpose, but you're not leaving your demographics and personal information with them. What that also does, it lets the system know that there is a pending screening and where to route those results back to. So quite often you may say, oh, I sent off the screening for an individual, I haven't gotten it back. You may have not included all the fields. You may not have put in the correct OCA number, and that's something I'll touch on quickly. If you do not know your OCA numbers, or if you're a person that has multiple sites, you only need one OCA number, technically. You do not need to have an OCA number for every facility. You can add as much centers or licensed centers that you have under that one OCA, under that one account. That minimizes the risk of you forgetting your password for this one and can't accessing that one, and you have multiple versions of yourself that you will not be able to manage effectively, and then you have more than one individual accessing that account, could create some potential issues for you. So what I'm here to tell you today is that review yourself, review your OCA number, make sure that you know it, make sure that it's correct, make sure that your account in the clearinghouse is active. They allow for 90-day period of time to change your your password. Make sure that you stay up on it, because quite often you get locked out. You may have to recreate a whole new account, which means coming to somebody like me or Mr. Patrick to get a new number, and that just sets you back a whole lot. You've gotten back the screening from the clearinghouse now, and you're looking at the results, and there is a box with a check mark, and it says there may be additional information, there may be additional screening information that the person who is fingerprinted need to request in order for you to make an informed decision about this person's eligibility. Not that the person is not eligible for employment or they're not eligible as far as their level 2 screening goes. It has to do with the Florida Abuse Registry check. Quite a number of individuals do have reports that are attached to their name that either had been verified or have some indicators as to the outcome or how that case was disposed of, making them a person of interest or a caretaker responsible, I should say. That individual, when you see that results and you see that check mark, that individual should request that report, the details of that report, and have it sent to them. Only they can request it. You, the owner, or the person who screened that individual, have no right to request that information because there are confidentials in that report that only they should have. And once they have gotten it, if they share it with you, that's up to them. That's up to the individual. And then you, the owner operator, make an informed decision whether or not you want to continue with this person in your employment. And that has to be done by you, the operator, to have that person request that report from the Florida Abuse Registry system. And once they get that report, then you can sit with that person and go over the details of that report. Certain pieces of information will be redacted for confidential purposes, but the main subject or the heart of the case and how it was closed will be made available to you or to the individual, and you guys make a determination on the future of that person's employment with you. We are not allowed to tell you, and quite often you'll call and say, oh, Mr. Fleury, Mr. Patrick, this person has a report and what should I do? No, it's not what should we tell you. You have to make that decision. We cannot tell you to hire or fire somebody because that person is not our employee. That is your employee and that is your decision to make. We can only tell you what the law says, what the rules are, but we cannot tell you to secure somebody or terminate somebody. That is not within our purview to do. So if you do run across that situation, discuss it with the individual and get the report and make an informed decision about what you have read or what was the outcome of that case, and you go from there. We're not going to intervene and tell you, well, this person should not be employed or should be employed, only unless it becomes a legal matter for us. Then we will most likely discuss it with our legal department and hand you a decision based on our needs and our interaction with that case and that individual. Moving on from that result. So anybody who has any questions about reading and interpreting the new screening requirements, because most of you who will be doing your screening, most of you who have done your screening from July 1 of 2016, some of you are coming up, please look at your retention dates. Your retention date is very critical. Please make sure that when you go to a vendor, that vendor is an approved clearinghouse vendor. That means they must take a photo to be attached to your fingerprints. Make sure that that person, that individual, meets the requirements set by the Agency for Healthcare Administration as a LifeScan vendor, and you can conduct business with that person. We cannot tell you what fees they should charge. That is not within our purview. So anybody who don't understand or may have been moving too fast, have any questions at this time that I can clear up?
Mr. Fleury, I have one. What if a provider has staff member who, due to the pandemic, still in their, they still have a list that that employee works for them, but the employee, because of they didn't have enough children or whatever the case may be, or the person didn't want to, that person was out for 90 days. When they come back, do they need to be screened again since they haven't physically been there?
But that person hasn't been active in as a caretaker. They might have gone somewhere else within that 90 days and served in a caretaker role using their screening, or they may have been screened by another entity. In such a case, somebody who is out for at least that 90 days and they're coming back in, recommend that you do an agency review. An agency review is basically refreshing your fingerprints. You're reviewing your fingerprints. And mind you, ladies and gentlemen, there are some scenarios where you will be required to do a whole new screening, but for the purpose of background screening and why the clearinghouse was conceptualized and put into play was your fingerprints don't change, and it does not become necessary for you to pay a whole new set of fees every 5 years to revisit your fingerprints and to review a record that doesn't really change much, or maybe something has happened within that 5 years, but your fingerprints basically stays the same. So what happens is you've been fingerprinted 5 years ago. 5 years later, you're up for a 5-year review. The person who you're employed with can now go in and initiate an agency review for you. And what that does, it revisits your fingerprints, have the system check your fingerprints again, and it is not as costly. It's between $12 and $15 to have it done, and you get back the results rather quickly if there are no new incidents. So what happens is somebody who has been out for 90 days, as Mr. Hurst mentioned, can be revisited without really missing a beat, and you're not really losing any downtime. The 90-day rule pretty much is still in effect, but you're not having to go nowhere and do a whole new set of prints for that purpose. So I will encourage everybody who have experience, who have that kind of situation, to do an agency review on that person. Now, if you did not take that person out of your profile, let's say they went out and they stole a candy from the baby. Police comes and police arrest that person, takes them in. The minute that arrest gets reported to the system, you, the provider who screened that individual, whose OCA number is used, will get notification that XYZ stole the candy from the baby. And of course, automatically that person is disqualified by an arrest. It does not mean that person is guilty or actually stole the candy. It does not mean that person is convicted of such crime. Just the mere fact of an arrest, and an arrest that is marked by one of the items on the affidavit, will trigger the clearinghouse to change your eligibility status to not eligible. And when that happens, that individual must get the final disposition of the case and send it back to background screening. Please do not attempt to contact the Agency for Healthcare Administration. I say this because they contract with DCF to use their system. They're the managers of the system, and they will only speak to upper level management people in DCF for background screening purposes, for establishing rules and guidelines. They're not going to talk to providers who are calling to find out why their fingerprints didn't go through or what happened to the check. They are not going to really talk to you or tell you anything. You might not even, your call might not even get through. And if you do, you'll be directed to call back down to the local office to go right back to where you started from. So your best bet is to contact your counselor and or background screening, DCF background screening. Your chances are much greater that you will get a response, or you can send in an email, or you can call the number and somebody will respond to you at that point. So I hope I've answered your question, Mr. Hurst.
Yes, sir. As always, I appreciate both of you all being here. Could either one of you speak to the after school piece, because that seems to be a hot topic with providers who want to serve the community and those that already have after school or school age. Could either one of you or both of you speak to the best way for providers to handle that particular situation?
Mr. Patrick?
Sure. Okay, so as we all know with the pandemic, schools are gonna go sorry about that, I was getting a call. We all know that the e-learning and online learning experience is taking place, and it will be taking place for Miami-Dade and Broward counties collectively, at least for the majority of the kids. So what that has created is an influx of kids who need care. And so what we have worked out, or at least after doing a little investigating, is that if a provider wishes to incorporate school-age kids into their program, they need to, first and foremost, they need to have school-age services as a part of their licensed services. So what that means, if you're a current childcare facility, which most of you are, and school-age children are not a part of that, you would need to modify that to include the school-age age group. Now, what that will allow you to do is to bring in those kids and provide care for those kids under your current license. Now, for the providers that are currently school age already and only provides care to school age children, which is typically during the hours of before school and after school only, for those that want to provide it during the day, if you're already a school age provider, it would be as simple as modifying your hours of operation, provide care during the hours for those kids that would be doing the e-learning and that type of online education. So if you're a school age provider already and it's a part of your services, then you just need to modify it to ensure that you're covered for the hours that you want to provide services for. Now, the rules and regulations that are already in play for school age kids will be in full effect, and they will be monitored, and you would have to ensure that you are adhering to them throughout the whole day, because now you are licensed for the whole day. Now, if you are not a school age provider already, as I mentioned previously, and you want to incorporate them, you would need to revise your current license and submit an application for school age, which is a school age application. There is a difference. Both applications can be found on our website. So you would fill out, let's say you're a child care facility and you don't have school age kids. You fill out the application for school age kids with all the information how you normally would, and you provide us a statement. And in that statement, that's where the clarity and will be provided on your end as far as what you want to change. And in this case, you want to revise your services to provide care to school-age kids. Now, what you would need to do once that is done is you would need to designate an area for these school-age kids to be at. And their area needs to be strictly for school-age kids only. So what that means is their classroom cannot interfere with any of the preschool classrooms and vice versa. When those old school-age kids go outside, they need to be outside. You need to make sure that those two programs, your school-age program that you're going to be providing and the child care facility, which is preschool, that they're completely separate. Now, your school-age program must be in licensed space. So what that means is you will not be able to go over your capacity. Whatever your capacity is what it is. It's not going to change unless, you know, there's an increase in capacity. If you have the space at a fire inspection, we can discuss that with you as far as increasing your capacity. But whatever's already in place right now, as far as what was measured and given to you, that's what you need to maintain that and stay under that number, as well as adhering to all the other requirements. So if you do wish to go down that route to bring in those kids to provide care, we'll support you and we'll help you out. But in order to do that, we need that application to be submitted so we can revise the license and start the paperwork. And then the counselor will make contact with you. And then we would just need to make sure that at that point that you have a classroom set up for them, a school-age classroom. So you shouldn't be, those kids should not be using, again, I was a very tall little kid, so I'm, you know, height is very, could be confusing for me, but ideally you want to make sure that they have school-age desks, chairs, equipment, toys, things that they need for their age group and their respective, you know, educational developments, cognitive developments, and so on and so forth. So it is possible. It's not impossible, but there are certain steps we need to follow. Does that make sense, or does that explain the process? Or I can always re-explain it if need be.
No, thank you, Patrick, Mr. Karch. That was because I know a lot of people, you know, they're in a situation where they've got to think outside the box. And a lot of questions come up. Well, what about after school? And we want to ensure that they do it properly, follow the guidelines, and they're not going to have any issues with any violations or anything, and they're able to accommodate the children and families in the community they serve while still following the DCF guidelines and not creating any unnecessary drama. So I appreciate that information.
No problem. And while Ian was explaining the background screening portion, I was able to provide some more information in the chat box. If for the listeners, if you have a few moments, or I mean, I don't want to you know, beat a dead horse or whatever the metaphor is, but you know, and I know I talk a lot, so I apologize for the monologue in advance. But I know training was a question that got asked in the group chat. I did provide Samuel Orr's number. For those that may or may not remember Samuel Orr, he is our liaison at Miami-Dade College. He oversees the testing centers, and you know, their testing centers are under, you know, their hours of operations have changed due to the pandemic. So as far as the testing sites and that piece of it goes, Samuel Orr is the one to contact to speak with. Now, I did also, in the chat box, I did include some language regarding competency exams and trainings. And I'll just briefly read that since it was asked. So just on March 22nd, 2020, Chad Popple, who's our secretary, our new, the DCF secretary, signed an emergency order that included training information. And what it said was, suspend section 402.305, parenthetical 2 and then E, Florida statutes for the purpose of promoting flexibility and allowing for alternative educations and testing methods for childcare personnel for COVID-19 has prevented access to the same. So basically the purpose of that is to allow a 6-month extension for the completion of competency exams due to the pandemic. And as I mentioned, the shutdowns and the stay-at-home orders. Therefore, students that need to take the competency exams will have until September 21st, 2020 to complete their testing. So that's about a month away. So for those that need to still iron out the testing, for those that it applies to, again, I gave you the number to Samuel Orrs in the group chat. And I apologize that I wrote a lot in there, so I apologize in advance. But let me pull up his number and I will read it out loud. Samuel Orr's number, for those that it's in the group chat, but his number is 305-237-2946. I believe that's his office number, or I'm not sure which number it is, but it's one of his numbers. And he would be a good person to talk to about when the testing sites will be open and how they will allow students to take the test. But for us, the extension ends in September on the 21st. So is everybody good with training or competency exams?
Thank you, Patrick. Thank you, Mr. Karch.
No problem. And then one more thing, Jeff, and then I'll
no, please.
I promise.
Don't worry.
I did include partner agency resources. So OEL and the ELC, for example, for licensed exempt school readiness programs that are non-operational. And again, if you've had a renewal recently as a school readiness provider and your renewal was not monitored due to the pandemic, that you're non-operational, that means that renewal, which is also your school readiness inspection, was not monitored. So what will happen is we still need to make sure that school readiness inspection has taken place in order for you to still get your funding from the coalition. Now, most of you that are non-operational or that were non-operational for a period of time, our staff are contacting you guys regularly, or should be contacting you regularly about when you guys will be reopening. So if you had a renewal, which is also a school readiness inspection, if that was not monitored and you're still pending your school readiness inspection, what will need to take place is when you reopen, whenever that time may be, you need to advise us, specifically your counselor, and that counselor will come out to your site when they have time to do so, and they will do a follow-up inspection, which will be a school readiness inspection. It will make up the inspection that was missed due to the pandemic. So in order for you guys to not have any issues with the coalition, and I'm not sure who this applies to, but you do want to communicate with us so we can do our end of the bargain to where you guys won't have any friction or gaps in payment or coverage or whatever the case may be with the coalition. And also, if you were issued a provisional license due to the pandemic, being that your renewal was not monitored and we couldn't monitor your, the standards that are applicable, that follow-up inspection will also allow us to do that. And will also help us to get you off of a provisional license. So the more you communicate with us and the timelier, the better, the sooner we can address all those elements for you. Then there's also a first responders program, and I put this in the group chat. So the first responder program is an incentive program available to providers that have a school readiness contract. The provider would be required to give priority to the children of first responders and healthcare professionals. So like I said, there is an incentive program they have. You can discuss it with your contract manager or the local Miami-Dade Coalition. Again, it's the first responders program. So if you're interested in that and participating in that incentivized program, I would recommend and encourage you to contact them accordingly. Now about the child care program, there's several waivers are available to providers that are on the USDA child care food program, at least through June 30th, 2020. Which I know we're past that date, but if you do have a contract with the food program, you definitely want to reach out to the representatives for more information. Some elements, for example, like the food program, have relaxed some of their requirements during this time due to the pandemic. So for example, if the provider is unable to find whole milk in the stores and for whatever reason buys 2% milk instead, it would be acceptable under the current, conditions. So, or even if a provider is unable to find vegetables and they have to serve two different types of fruit in lieu of that one veggie, that would be acceptable as well. So those are just like two examples of where the food program is showing their leniency as far as, with the pandemic at hand. So, and then of course, if you have any menu substitute or any substitutions, or if you have to substitute, food, just make sure that they're noted on the posted menu, and so on and so forth according to the DCF's rules. So that being said, I've included all that in the group chat. So thank you for listening to me as I went through my monologue. If you have any questions, let me know. But I just want to thank you guys for giving me the time to meet with you guys and talk. So thank you.
Well, I just want to, on behalf of DCF and on behalf of MCI and the providers, thank you very much, Dr. Fleury, Mr. Karch. As I said earlier, the two not that they're old, the two senior supervisors, and Dr. Fleury is the one that's trained everybody, including Suzette, myself, Patrick, all of us. So it was very fortunate for us to have them both here. If anybody has any questions, or Louise, Ms. Sallons, if any closing remarks or anything you want to share, you have to unmute.
Okay, I was reading what Patrick was writing in the chat box, and I was looking at the thing for the CPR. So it says CPR, we can complete it online. So maybe you want to highlight a little bit on that, because maybe providers don't know how to go by that. So maybe you want to say a little bit about that.
Sure, and thank you for bringing that up, because that is a unique item. So now the online training, now as we all know, first aid and CPR, we, especially CPR, we require it to be hands-on. That's always been in place. And now with the pandemic, that's an issue, because a lot of us are doing social distancing. So now what we're allowing is, we are allowing the online versions to be accepted at this time. However, you still need to have the trainer that you're dealing with attest to your understanding of those requirements of what needs to be done. So now how that looks as far as documentation, it's going to vary based off the vendor that you're dealing with. Ideally, a written statement from the trainer will work, or if there's a CPR card that has the verbiage that says the individual Jeffrey Hurst understands, and I'm attesting to his understanding of the first aid and CPR requirements, and we could accept that. And so in addition to that, the online version of this is really should be geared towards people who need to renew their first aid and CPR, not the people that are getting it for the first time. Now, again, we know it's going to be difficult, so we're not really, we're recommending that for anybody who's new to the table to getting first aid and CPR, that they actually go the old-fashioned way and do it hands-on, if possible. Now, if that's not possible, then the online version can be accepted. Now, however, once the state has gone back to a state of normalcy, the expectation is those individuals that did the online training that was accepted, that they should then get the hands-on one. So that way, everybody has that peace of mind that this individual knows how to do it like on a hands-on level. Now, the good thing about that is that those hours can be counted towards your in-service hours. As we all know, first aid and CPR typically is 4 hours each on in-service training. So you can use that to address your 10 hours of in-service training. So when it does say that it can be completed online, that is correct. It's only during the time frame that that while we're dealing with this pandemic. And again, ideally, it's more so for the individuals who are renewing their first aid and CPR. However, again, we'll accept it for both groups. Does that make sense, or does that?
Yeah, thank you very much, because sometimes a little bit information is always needed. At this point, I would say I want to thank you. I want to thank Mr. Fleury. I want to thank those who still stayed with us, that they have gathered a lot of information. It's a lot of information at one point. But I wish we didn't have like our entire team that usually visit because of other circumstances. But we are more than willing to, if there's any link, whether you post it for us, if Jeff can get hands-on on it, so we can submit it to the providers, so that, and I'm thinking more with the people for September 21st that need to take the competency test, because there were issues on that. I heard yesterday somebody was talking to me and said, I took all the classes, but what about the competency test? Do we need to go to the college? So no, there's the answer right there. Unfortunately, those people did not attend this meeting who had those questions. But for me, listening to what they have to, what their questions are, I can always refer back that the answer is right there. You know, so this information was very, very great. And I thank you so much. This is what we need. We need to break through this thing so people get educated and not getting frustrated what they're doing. And I wish we had more providers on our Zooming, because some are open, some are closed. Some of them we cannot reach them, but I thank you so much for this opportunity. And then we have great news. We have more news to information to share gradually when we're moving along. Jeff?
I just want to thank all the providers that stayed on. I do my Friday updates. Every Friday I put information. I will include the information that Ian Fleury and Patrick Karch shared with us. And again, when you have questions, reach out to your child care licensing specialists, the providers. Everybody is there. We are a resource. Yes, we're a regulatory body, but we're a resource to assist you, especially, as Patrick was saying, in these uncertain times. Now's the time for you to be on top of your game and find out ways to correctly navigate through this without running into a rock, so to speak. So I thank everyone. Ian has shared his work cell number, Patrick. So you've got a lot of people that you can reach out to. I encourage you to always go onto the website and look for the latest information. Check the executive orders on your own, and stay safe. And I thank everyone. Dr. Fleury, I can't thank you enough. Mr. Karch, I can't thank you guys enough for always being supportive and for being there for the providers throughout the Southern region. But thank you for coming on to MCI's special Lunch and Learn. So thank you. And Ms. Louise, as always, you are the best. Thank you for putting up this all together and making it happen. So thank you.
Thank you, everybody. Thank you.
Thank you.
Thank you, Mr. Hurst.
If you guys need anything, just give us a call.
Sure.
Thank you, everybody.
Thank you.